Capacity crowds at concerts and games, restaurants and bars bustling.
On the surface, it would appear the pandemic is behind us, but as you'll see in our exclusive tour tonight, the story is far more grim in our local ICUs. Good evening, I'm Heather Skold.
And I'm Bart Bedsole. ER wait times stretching to 18 hours. Certain surgeries now being put on hold. Hospital units potentially forced to close down.
Colorado Springs hospitals are at the breaking point, intensified by a shortage of willing workers. KRDO News Channel 13 Sydney Stell spent hours inside the COVID ward at Penrose Hospital on North Nevada today. She joins us live now. Sydney.
Heather, Bart, we were the only station inside the COVID-19 ward here at Penrose Hospital today. Nurses there dealing with what some are calling compassion fatigue for being in the middle of this pandemic for so long. And now with staff stretched so thin, hospital officials are forced to start limiting care.
We're very full. We're very full across both of our hospitals.
The CEO of Penrose St. Francis Health Services, Dr. Brian Erling, made one thing very clear Tuesday. The pandemic is far from over. Chief Nursing Officer Roseanne Shabona says the pandemic is causing many of their healthcare workers to retire early.
They're tired and they've worked extra shifts. And we've got a lot of different recruitment strategies, but we've had to supplement with the travelers.
They've brought in healthcare workers from all over the country to supplement. They've even raised their wages for all of their employees, and now they're looking at bringing in staff from other countries. The recent wave of COVID-19 cases, coupled with that labor shortage, is forcing some tough decisions, canceling elective procedures being one of them.
If you're the spine patient that needs to have spine surgery to stop your opioid use and get you back to work, that's serious.
Of all the COVID-19 positive inpatients at Penrose right now, 85 to 90% of them are unvaccinated. Despite sounding like a broken record, Dr. Erling is urging everyone to get the shot.
I think the myth that's out there is that, well, I'm young, I'm healthy, I work out. If I get COVID, it'll be like the flu and I'll be fine, at least I'll have antibodies. We have a patient in one of our ICUs right now who's in their 20s, unvaccinated, previously completely healthy, who's on a ventilator.
The message goes for his staff, too. Around 77% of their associates are vaccinated, but that leaves nearly 700 who aren't. And if they don't get an approved exemption or proof of the shot by November, that will limit care even more in light of Governor Polis's healthcare worker vaccine mandate.
If we lose associates through the mandate, I have concerns that we will need to rationalize our services. So we may need to close a unit or limit procedures, things like that. That's a tragedy that we're really hoping to avoid. We don't want to lose a single associate over a mandate.
As for a light at the end of the tunnel with this pandemic, Dr. Erling doesn't think there is one.
The great influenza pandemic of 1918 happened 103 years ago, and I still get a flu shot every year. This isn't going to be over anytime soon, or likely not in our lifetimes.
Now, they are starting to see more long haulers or people coming in here with COVID-19 symptoms lingering weeks or months after they tested positive. Since your symptoms are typically a lot less severe when you do have the vaccine, this is just another reason officials are urging you to get the shot. Live here at Penrose Hospital, I'm Sydney Stell, KRDO News Channel 13.